Hello, Ipswich. I'm Tony Marino, your town manager, and we're here to give you a quick COVID-19 update. We haven't done one of these in a little while, so we just wanted to give an update on where we stand right now. Today being October 29th, Thursday. We are anticipating with our case count numbers, as everybody may or may not know, we went to green last week and we've had a few extra cases this week, so we anticipate we're going to be in yellow, but I will let Colleen Furman, our public health director, go through that when we bring her on in a few minutes. I also want to take the opportunity to thank everybody that came out for town meeting. We had that a couple of weeks ago on that rainy Saturday morning. We did better than the meeting in June, over 400 people in attendance, so thank you for that. We did get a lot of the town's business done, so we appreciate you coming out and taking the time to partake, so thanks for that. This Saturday will be Halloween. We do have some updates on our website. Trick-or-treating will be happening in Ipswich, albeit safely. We did put some recommendations and guidance out there with regard to, some tricks, ideas for, maybe putting candy at the end of your driveway, trying to avoid door-to-door, things like that. But we aren't going to have any town-sponsored events, so we will not be closing down High Street. We won't be doing anything in the downtown trick-or-treating or anything at the fire station or things like that we've done in the past. But being a Saturday night, we anticipate, kids will be out trick-or-treating, so please drive safely, slow down, and enjoy the night. It will be cold, so make sure you bundle up. Sheila Taylor could not be here today, our Council on Aging Director, but I did want to give a few updates on what's going on there. They are continuing programming, doing it safely and social distancing. A few of the things they're doing are some exercise classes. They've got gentle bend going on, Patsy's exercise, seated yoga, some Tai Chi classes, and ping pong. For the creative things, they're doing drawing, watercolors, in the painting studio. And some other things they've got going on are chess, French, writing group, knitting, bingo, and low vision group. There are options for those at home. Take a look for some Zoom presentations and the YouTube channel, Facebook updates, and they have some pre-recorded ICAM things as well that they did with the Senior Center. Shine counseling is continuing, and during the Medicare open enrollment, they're doing it by phone, and you can call the COA for an appointment. For Thanksgiving, there will be the drive-by hot turkey lunch on November 19th at the COA. So they'll probably be packaging up a hot lunch for you to pick up there, so you can call the COA to get on that list. And the American Legion Post in Gloucester is also doing their Thanksgiving meal delivery on Thanksgiving Day, and you need to call the COA to register. There is intergenerational reading support within the Winthrop School via Zoom. And obviously, they're ready at any point to jump in should, emergency services needed when necessary. One other thing Sheila wanted me to point out is that they have revised the layout of their space to do social distancing. So when they do the bingo inside and things like that, now that it's getting a little too cold to be out under the tent, they have reconfigured the spaces so they can safely social distance people inside. We've got some programming going on at the YMCA. So Chris Bevilacqua said to check out their website for any updates on what's going on there. And also a reminder that they will be closed this coming Tuesday, November 3rd for elections. And with regard to elections, early voting will wrap up tomorrow. But we are open today 9 a.m. to 2 p.m. for early voting, and tomorrow 8 a.m. to noon, matching up with town hall hours. But October 30th is the last day for early voting. And then, obviously, Election Day will be open. You can still mail in your ballots, but Election Day voting in-house will be at the YMCA, and that will be on November 3rd. And with that, I'm going to pass it over to our school superintendent, Dr. Brian Blake, and he'll give you an update of what's going on with the schools.
We've made it 7 weeks now. We're in school. We've been very fortunate to be in school this long and operating successfully in our hybrid model. The model actually helps us to manage any COVID contacts that we have quickly and efficiently. We've reached the first benchmark of the year as we close in on the end of the first quarter already. Remote learner parents were given the option of remaining remote only or switching to the hybrid model, and we've only had 8 of our families decide to go to the hybrid model, and they'll be coming into school the week of November 9th. Students are engaged and are enjoying being back in school. We've had very few discipline issues this year. Kids have been very respectful of the 6-foot rule and mask wearing and sanitizing their hands. They're taking good care of their workspaces and cleaning their workspaces before and after use. And the buildings are continuing to be completely disinfected twice a week. Staffing is a concern. We have a lack of substitute teachers, which makes it difficult to cover staff absences. So if you're interested in substitute teaching at all, please give us a call at the central office. Our fall sports program is coming to a close already. Our athletes participated in golf, cross country, soccer, and field hockey. Football and competitive cheer were not authorized to play this year. We're awaiting guidance from the MIAA and DESE for winter sports, which typically start right after Thanksgiving. We have had some positive COVID-19 cases in the schools and have been successful in following all of our protocols and limiting exposure to others. As I indicated earlier, the hybrid model, with most students attending in person just 2 days a week and then 3 remote days, has actually helped to reduce the spread when positive cases have been detected. In some cases, the student hadn't been in school for almost a week before symptoms showed, so there were no close contacts identified in the school at all. Overall, the school year is going well. Students are engaged. Teachers are working harder than ever. Parents have been very supportive, and I want to acknowledge the hard work that they're doing as well at home and stepping up to help their children. We are concerned about burnout for our staff across the district as we continue down this road. We're starting to anticipate that at some point, if cases continue to rise, that we may have to move to a fully remote model for some period of time, and we're prepared to do that. We've been planning for that since the summer. So that's about it for now. I'll turn it back over to Tony. Have a good week.
All right, thank you, Brian. I appreciate it. And now we're going to bring in Colleen Furman, our Public Health Director for the town of Ipswich, who will give us an update on what's going on with the case counts and the map and everything that's going on with regard to our public health in Ipswich. Thank you.
Hi, I'm Colleen Furman. I'm the Director of Public Health. I'm here to review what's happening as far as COVID-19 case counts and what we can do to try to bring it down. So currently we have had a total of 108 confirmed cases, and we have 13 people that are actively infectious and under isolation. We have 29 contacts that are under quarantine. And unfortunately, this is kind of a trend we're seeing where locally in Ipswich and also in the state, case counts are increasing. So it's important to review what we can do to try to prevent the spread of COVID-19. And those things are wearing masks, social distancing, hand washing, and basically not touching your face as much as possible. I wanted to focus on 2 of these tools, so masks and social distancing. So masks are really important because someone can be infectious for 48 hours before showing symptoms. In other people, they never get symptoms. So it's hard to say whether or not you actually are carrying the virus, even if you're feeling well. So masks protect that person from sharing the virus to other people. When they're in close contact, they could spread the virus through coughing, sneezing, and sometimes even talking. It's also important, even if you are practicing social distancing, to wear masks, because masks are a risk reduction tool, but they don't replace social distancing. So again, people can be infectious and not know it. So we want to spend some time thinking about how we are around other people outside of our household. You want to practice social distancing, which means being 6 feet apart from those other people, because again, we don't know who has the virus. Masks are a great tool, but all tools are important, and social distancing is one that's really going to help bring the case count down. What happens is when there is a case, we have to look at who has been a close contact to that case. Those people then need to quarantine. So close contacts are basically people are identified of having spent a cumulative total of 15 minutes with someone who is infectious over a 24-hour period. So that could be you spent 10 minutes here with someone, and then a few hours later you spend another 5. So you want to be really aware of how you're interacting with other people outside your household. Close contacts need to quarantine for 14 days, and they can actually get ill and then have to go into isolation. Once you have the virus, it's really hard to keep it from spreading to other people in your household, and that could present a real challenge, especially as far as parents are concerned with little kids, or maybe someone caring for an elderly parent. Because you have to interact with that person over and over, your exposure continues until that person's cleared from isolation. At that point, your 14-day quarantine period would start. So you'd see that you could potentially be out of work and in your home for 24 days. So again, you want to look at how you're acting, wearing masks, social distancing, hand washing, doing all that to help keep those case counts down, protect yourself and your household. It's also important to think about what happens to businesses. If there's a case and they have to identify the close contacts and they have other employees that need to stay home and quarantine for 14 days, this could result in a business having to close for a few weeks. Unfortunately, this does happen, and even though everyone's doing their best, we want to continue to try to minimize the impact of cases on the businesses in Ipswich and elsewhere. In addition, when you look at the rising case counts, we have to look at how the governor has set up his basically map. There's 4 stages. There's gray, the lowest risk, green, low risk, yellow, medium risk, and red, high risk. So currently, if you looked on the state website, you would see Ipswich in green. Based on the activity that we've seen over the last couple of weeks, it looks like we're going to be in yellow. So we're moving up to that medium risk category. We want to make sure we don't end up in the red. What happens is when you hit red for 3 consecutive weeks, all the businesses in Ipswich would have to revert back to step 1 of phase 3 from where we are currently, which is step 2 of phase 3. The impact of that is that a lot of businesses would have to decrease their occupancy, and even some types of businesses would have to close. So I just wanted to point out to you, there's a lot of impacts in the household, in businesses, and in the community. So I'm just hoping that we can all continue to do our best, and I thank everyone for trying to do their best to try to keep the case count down. I also just wanted to mention that we do reach out to contacts and cases that live in Ipswich. So if you're getting a call from the local public health department in Ipswich, please answer that call or return that call. It's very important that we identify close contacts and get them into quarantine so that they're not inadvertently spreading the virus if they become positive. And we want to make sure that we can give guidance and proper instructions to those people who are actually sick with COVID-19. I have a number of nurses you could hear from. Pam Lara, who's the public health nurse for Ipswich, who's been working with us since 2007. And we have some newer nurses, Rachel Lee, Tina LaCourse, Jennifer Reed, and also Sharon Gallant. If any of these people call you, please return their call. Also, if we get overwhelmed with cases at a local level or a number of contacts, we may reach out to the CTC. So if you do hear from them, please, again, answer the call or return their call. If for any reason you are unsure if somebody is calling you and asking you about being ill and you're not comfortable that whether or not this person is legitimate, please call the Public Health Department at 978-356-6606, and we can verify if that person who is calling you is legitimate. So certainly don't ignore the call, respond to the call, and we are here to help. Lastly, in closing, we do help the business community working through these scenarios with cases. They can be challenging and confusing and a little overwhelming at times. So as a business operator, if you are contacted by an employee or a patron and told that they have tested positive, please call the Public Health Department. Somebody will be assigned to work with you, to work through your questions and help you make great decisions so that you can get up and running again after you've had your facility cleaned. Thank you very much.
Thank you, Colleen. And I want to pick up on one thing Colleen talked about with the businesses, specifically the restaurants. In phase 3, step 2, we were allowed to, with certain safety precautions, open up the bars again, with plexiglass shields and spaced out seating. But I want to be clear on that. That does not include groups of 6 or 10 hanging out at the bar. You can't have 3 people in a chair and then groups standing behind them. Those same social distancing protocols, you have to be in a chair and you have to maintain safe social distancing from your party to the next party. So I want to stress that we want to be able to stay in phase 3, step 2. We don't want to have to revert back, but we have had a few issues where we've had to go out where, there might be some confusion over what's allowed. So I do want to be clear on the bars. You need to, not only do the bars have to have the plexiglass in place, but you need to stay, with your party, groups of 3 or 4 at the bar, and then be 6 feet away from the next party. And if that, you cannot cluster together and, be 2 or 3 deep, like we used to be back before COVID happened. So I just wanted to stress that, because like Colleen said, if we are go to the red and stay in the red for 3 consecutive weeks, these restaurants that have really been working hard all summer to follow the COVID protocols and try to have enough patrons in there to stay open have been working hard all summer. We don't want to have to revert back, and we'd like to maintain this, phase 3, step 2 all the way through the winter months, and hopefully, eventually get our way to phase 4, but, that won't happen before the springtime. So I just wanted to stress that. We've done a great job here in Ipswich. I want to continue to do a great job. We want to keep our case counts low. If you have any questions, feel free to call my office or the Board of Health office. But I did want to stress that we need to remain vigilant, practice our safe social distancing, and do what we can to keep our business owners, residents, and everybody in Ipswich safe. Thank you very much. We appreciate your time. And again, if you do have any questions, feel free to reach out to my office and or the Board of Health office. Thank you very much.
Help prevent COVID-19 with social distancing. Call, FaceTime, or online chat with friends and family. Stay home as much as you can. If you must go out, don't gather in groups. Stay 6 feet away from others. Don't shake hands or hug. And please continue to wash your hands frequently. For information, visit mass.gov/COVID-19.